The benefit is that when you're doing a colonoscopy, you're eliminating the polyps and therefore decreasing the risk of them turning into cancer.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Sandra Peebles. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about colorectal cancer and how to catch it early. And it's not just about colonoscopies. Joining us to talk about this is Dr. Victor Maciel. Thank you so much for being here, colorectal surgeon at Baptist Health, and also Dr. Ariel Sims, Gastroenterologist at Gastro Health. Thank you both for being here.
Thank you for having us.
And let's begin our questions as we dive right in. Dr. Maciel, tell us, what is colorectal cancer and why do we screen for it?
Colorectal cancer is a malignancy that arises from the inner lining of the colon, the mucosa, and starts growing in the form of a polyp. If you let the polyp grow to a certain size, the chances of the cells containing the polyp turning malignant increases. And when that happens, those cells can start traveling down into deeper layers, turning into cancer and spreading. So we screen for this disease because if you catch the polyp before this spread and travel to deeper layers happens, you can prevent it from turning into cancer.
And that's what we call early detection. Why is this early detection so important, and how does it affect patient outcomes?
Early detection is very important because if you catch the cancer in the earliest layers, you can have up to or very close to 100% cure rate. And obviously the rates decrease as the malignant cells travel down. But this is still pretty good if you catch it at early stages. It can go down from like 99% cure rate to 95% in the first and second layers. Beyond that, the outcomes are a lot worse.
And so that brings us to the screening. And Dr. Sims, I wanted to call you Ariel. Dr. Sims, what are the guidelines on screenings and how often should a person screen and at what age?
Sure. The guidelines for screening for colorectal cancer start at the age of 45. So when anybody turns 45, they should have colon cancer screening, whether that's through a colonoscopy or another modality. Typically, we screen up until the age of 75. So even if you are above 45 and you haven't had your colonoscopy, it's still not too late, but everyone should ideally have it at 45.
How often should a person get screened and what are the impacts, say, for lifestyle, Dr. Maciel, lifestyle, age, family history?
Mm-hmm. So the guidelines that we were discussing just now are for average risk individuals. For patients that have higher risk, for example, close family members, parents or siblings that were diagnosed with colon cancer, then you might need to adjust the screening. For example, if your father was diagnosed with colon cancer at 50, instead of waiting until you're 45, you need to be tested at 40. And the same goes for patients that know that they have that they carry, genetic risks, but is not a recommendation for average individuals. So if you think that you have a higher risk than normal, the best thing is to check with your physician.
And how are screenings different, say, for someone with family history or someone that has a higher risk? Are there different tests? Is it a different method or?
Sure. So anyone who is at higher risk for cancer, like Dr. Maciel mentioned, if you have a first-degree relative with colon cancer, it would be recommended that they actually have a colonoscopy, which is the gold standard. There are other modalities for screening, like stool-based testing, something called a CT colonography, or even the new blood test for screening. But if you are at high risk, it's best to just stick with the gold standard for screening, which is a colonoscopy.
Tell us about that blood test. How does that work?
Sure. So there's a new FDA-approved blood test. It's called the Shield. So it's just a simple blood draw. The blood test looks for certain DNA markers in the blood that a colon cancer cell would secrete. So that's kind of a way to screen. So it's easy, it's cost-effective, and it's best for anybody who's trying to avoid maybe some of the risk of undergoing the procedure. And so I feel like it's also able to get screening to people who otherwise wouldn't because they're trying to avoid the procedure.
So let's talk about that, because a lot of people have misconceptions about what a colonoscopy is. They're either embarrassed because they're machista. It is the rectum. It is the anus. And I know that a lot of people feel a funny way about that. But the reality is that we need to have a healthy colon and rectum so that we can eliminate and enjoy our life in a very healthy way. So what are some of the excuses that people give you, and how do you address them?
So what I heard when patients are hesitant to come and see a specialist is because they've heard from other friends or family members that had colonoscopies in the past, had a bad experience. I tell them that in the last 10 years, the techniques that we use have improved. Like, for example, we use a different kind of gas that helps the colonoscopy feel better. Patients after a colonoscopy don't feel bloated as they felt when we use a different kind of gas mixtures. In addition, the sedation they use these days is a lot better. So minimal side effects, and the risk profile is actually a lot better. The scopes themselves haven't changed much. So there is still a 0.1% risk of bleeding and perforation. But when you put it the other way around, if any particular patient will have a 99.9% risk of everything going well and not having a complication. So if you trade that off for 10 years of peace of mind, most of the patients agree to have the colonoscopy. So it's just a matter of explaining and, clarifying the misconception.
Well, I myself had a colonoscopy. Just for the sake of the conversation, I'll share that I had a very pleasant experience in the sense that I didn't know anything. When I woke up, everything was just fine. And they really attended to me with such grace. And it was here at Baptist Hospital. Dr. Sims, walk us through the process of what the person might go through when they go into a colonoscopy.
Sure. So typically when you arrive to the endoscopy unit, you'll be in the preoperative area, you'll meet the nurses, you'll see the endoscopist, the person performing the procedure. You'll also meet the anesthesiologist or the nurse anesthetist. They'll ask you to change into a gown. And then once you're back in the procedure area, they will administer IV sedation. So typically it'll take seconds, maybe a couple minutes to fall asleep. And then once you're asleep, you won't really remember or feel anything. But during the procedure, we use something called a colonoscope. So it's just a small, thin, flexible wire with a light and a camera on the end. It's like the diameter of your pinky. And then that goes through the rectum. And then we kind of slowly advance it all throughout the colon. As Dr. Maciel said, we use water and air to kind of clear off the surfaces. We're looking meticulously for polyps. If we find those, we have special tools so that we can remove them with. If we find any other abnormalities in the colon, like inflammation, we can take biopsies. And the procedure itself probably takes anywhere from 20 to maybe 45 minutes to actually do, but the patient won't remember or feel anything. And then once we're done with the procedure, they'll gracefully wake up, and then we'll talk to them about the results in the recovery area.
And even after the fact, they don't really feel anything. I think the worst thing about a colonoscopy maybe is the cleansing that people complain about, having to take that product that helps you eliminate.
Exactly. The bowel preparation is really what people complain about. It's not the actual procedure itself, since you're asleep. So typically the bowel preparation is done the evening before. You have to stick to a clear liquid diet. And then you drink the bowel preparation around 5 p.m. It does have you running to the bathroom, but we want that so that the colon is completely clear of stool, so that we have good visualization when we're inside. I know a lot of people have concerns about the prep with regards to the volume, the taste, but nowadays we have better bowel preparation. It's lower volume, so a little bit more palatable and tolerable for patients. We also have something called Sutab, which is a tablet-based prep. So instead of drinking the prep, you can actually take 24 tablets to clear out the colon.
That one sounds familiar to me. I might have had to have done that one. Dr. Maciel, we talked about the different kinds of tests. Of course, there's the gold standard, which is the colonoscopy. We talked about the Cologuard, the biomarkers. How do they compare? What's the difference between one and the other? And when a patient is trying to make a decision, what should they really be looking at?
Well, I am a supporter of the gold standard because I think it is important for the patients to know that no test is perfect, but the gold standard is actually the best test for diagnosing and treating. Even if a patient has a negative Cologuard and I do a colonoscopy for a different reason, sometimes I find polyps that were missed by the Cologuard. And the same way around, when a patient comes in with a positive Cologuard, that require confirmation with a colonoscopy, sometimes I find nothing. So
false positives.
False positives and false negatives.
Right.
It is a good test for certain individuals, but it's not perfect.
But some people still prefer it because
some people still prefer it. Now, the frequency that you need to do a Cologuard is more frequent than a colonoscopy. You have to repeat it every 3 years.
and it has an expense.
It does, and you still have to collect stool and send it. So it's not
right. It's somewhat uncomfortable.
It is a test still, right? So nothing comes for free. But the majority of my patients, when I explain the differences, most of them prefer to undergo a colonoscopy and get a longer period of peace of mind, knowing that they had the best test and they can get more years in between tests.
And Dr. Sims, how can doctors and healthcare providers in general get their patients to undergo this screening? And are there certain communities that are more at risk?
Sure. So I think the big thing from a clinician standpoint is just increasing awareness and education for the patients. I think that a big barrier for people is that they don't know what it is or what it entails, or they may have false misconceptions about the risk of the procedure. So I think that just addressing those specific concerns and providing solutions to any of those barriers would be the best step to increasing screening. And certainly we know that there are certain ethnic groups that are at an increased risk for colorectal cancer, specifically African Americans, particularly males are, and lower socioeconomic communities as well, just because of not having the resources to be screened or just lack of awareness about the procedure and other modalities for screening. Because I think some people think that you have to have a colonoscopy and they're not aware of all of these other methods for screening.
And I think that's why these forums are so important, to have these discussions openly. And without the stigma, right? So a lot of people feel funny about this type of thing, and it's really important to have this conversation openly, like we're doing. We were speaking about the different tests, but how do you see when the person is going to make a choice? What are the factors they should consider?
I feel that the decisive factor is, and the main benefit from a colonoscopy versus the others, is that the colonoscopy is actually a therapeutic test. So basically, you can make the diagnosis and treat the polyp. Okay, the other test only give you an answer whether or not you have a positive or negative test.
So you're going to have to circle back to this procedure.
And the benefit is that when you're doing a colonoscopy, you're eliminating the polyps and therefore decreasing the risk of them turning into cancer. None of the other tests provide this advantage.
So right there at the moment when that polyp is removed, you're literally just removing the entire possibility of that cancer continuing to spread.
The majority of the colon cancers arise from a polyp and grow over a period of years. So by eliminating the root cause of the problem, then you're decreasing the risk of cancer.
And it's in the same procedure, the same way you wake up, you don't remember, and it's all over.
Correct.
Right then and there.
That is the decisive thing that my patients consider when choosing a colonoscopy.
I had this conversation with my doctor as well when I had to go through this, and I considered the Cologuard as an easy way out. But no, we went with the colonoscopy, and I'm very glad, to be honest with you, especially after having this discussion with both of you medical professionals. Dr. Sims, let's talk about technology. I'm passionate about technology, especially how it relates to health. What are some of the emerging technologies or advances that we have in this field that are helping not only make this maybe a more precise screening, but also more accessible to people?
Sure. So we talked about the blood-based screening called the Shield, which definitely makes screening more accessible through an easy blood test. Another emerging technology that helps reduce the risk of colon cancer is we now have AI-assisted colonoscopies that help the endoscopist detect really small, flat polyps that we otherwise could miss with the naked eye. So with these AI-supported techniques, we can see these small polyps. So it's almost like having a second observer in the room to detect these polyps.
How does the AI work in this case?
So when we're doing a colonoscopy, we have a screen where we're looking for the polyps, and the AI will put a little box around certain areas that are like small polyps that we otherwise may not be able to see because there are really flat polyps that can easily be missed. So it highlights those things.
Yeah, it's exciting to see what technologies have to offer us for the future. We spoke about the blood test to detect possible cancer, colorectal cancer. But let's talk about this as far as how do we see the future of those blood tests and how effective is it really? Do you think we're going to be using that? We're going to be counting more on this type of testing?
I hope so. I'm not sure that this test is widely available for all communities and for all patients. And I'm sure that the same way that other technologies have evolved at a fast pace, this test will also be more readily available and better at detecting cancers. The future will tell, but we'll definitely see a lot of advances in this area.
Yeah, it's definitely very exciting to see how science is moving forward. I mean, I guess it always is, but now with AI and so many technologies, I'll ask both of you, but Dr. Sims, I'll begin with you. What message would you have for someone that is putting off getting screened?
Sure. I would say for anybody that's putting off getting screened, making sure to just talk to their healthcare provider about what their misconceptions are, what their barriers are, so that that provider can really address what the obstacles are between them and getting screening, because I feel like everyone should be screened for colon cancer. There's no reason not to, because of all of the different modalities that are safe. And I would just encourage everybody to kind of take ownership of your health and talk to your healthcare provider about it, because it really can be the difference of life and death and saving your life from potentially a colon cancer.
And Dr. Maciel, what's your perspective on it? Any message for people that might be hesitant at this time?
I would second Dr. Sims' message. It is very important to get screened, and it's really not as bad as you may heard in the past. We've made a lot of improvements, and now a colonoscopy is easy, pain-free, and very safe.
And there's always that possibility of that, but when you get the diagnosis, it's also gone.
Correct.
And so that's quite magical.
Right. And it gives you peace of mind. It can give you many years of peace of mind.
Thank you so much, both of you, for sharing all this information. It has been a great conversation. Thank you so much, Dr. Sims. Thank you so much, Dr. Maciel, for sharing your wisdom with us and this insight for our audience. And remember, viewers, be sure to hit that subscribe button on our channel here so that you can keep up with the latest health and wellness information and tips from our experts. Thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.